Ladies and gentlemen, greetings to you all from Dr. Ashok Kumar Batham, MBBS, MD, DCR. I would like to make an appraisal to you of the non-epileptic therapeutic applications of anti-epileptic drugs. In my previous video, I talked about the uses of these drugs in the management of cardiac arrhythmias and various neuropathies and neuralgias. In this video, I would like to tell you about the mood stabilizing properties of these drugs that are useful in the treatment of bipolar disorder, what we call manic depressive psychosis. Bipolar disorders and epilepsy have some common features, like both of these are episodic in nature, and neurophysiological studies have demonstrated that both of these conditions are associated with kindling phenomena. Understanding of the basic mechanisms of mood stabilizing action and clinical trials have led to the regulatory approval and use of anti-epileptic drugs like carbamazepine, valproic acid, and lamotrigine in the treatment of bipolar disorder. Carbamazepine, as a matter of fact, has been known for a long time to possess mood stabilizing activity useful in bipolar disorder, and therefore the Canadian Network for Mood and Anxiety Treatments and International Society for Bipolar Disorder, having looked at the substantial clinical trials data, have recommended carbamazepine as an alternative to preferred agents for patients with bipolar major depression for prophylaxis of manic and mixed episodes. Valproic acid's efficacy has been established in clinical trials in patients meeting DSM-3R criteria for bipolar disorder hospitalized for acute mania, and therefore this is also an approved drug for this indication. The third drug which is approved for this indication is lamotrigine, which is indicated in bipolar disorders to delay the time of occurrence of mood episodes like depression, mania, hypomania, and mixed episodes in patients who are 18 years or older in age and are treated for acute mood episodes with the standard therapy. The target dose of lamotrigine for this purpose is 200 mg per day. And lastly, I would like to add that benefits of topiramate in the treatment of symptoms of borderline personality disorders have also been reported through the organization of randomized controlled clinical trials. It's an important observation which may lead to future approved clinical indication of this drug in personality disorder of the borderline nature. With these lines, I would like to end up this thing and move over to the next important application of anti-epileptic drugs, particularly pregabalin, in generalized anxiety disorder. Generalized anxiety disorders are difficult to treat, and one more difficulty is imposed when it comes to drug therapy, that most of the drugs that are employed for this purpose run the risk of drug dependence and abuse potential, and therefore people are generally refrain from using those drugs. Here is a hope for them, because pregabalin has been found to be effective in the treatment of generalized anxiety disorders, and it appears to have anxiolytic effects similar to benzodiazepines with less risk of severe cognitive and psychomotor impairment, developmental tolerance, dependence, and abuse potential. This drug is superior in terms of producing more consistent benefits in psychosomatic symptoms of anxiety as compared to benzodiazepines. So that's another advantage, that psychosomatic symptoms associated with GAD respond better as compared to benzodiazepines. And Additionally, this drug has a beneficial effect on sleep and sleep architecture, and therefore the WHO, the World Federation of Biological Psychiatry, recommends pregabalin as one of several first-line agents for the treatment of generalized anxiety disorder. With this, I would like to conclude by saying that anti-epileptic drugs have been finding a large number of therapeutic applications in the area outside epileptology. Thank you very much indeed. God bless you.